Okay, welcome back. And we're going to be talking about healthcare delivery systems as it pertains in Chapter 2. This is the second of two video lectures. And let's get started. Okay, in terms of healthcare delivery, we can't really talk about anything for too long without getting into US government policies. The United States government under CMS is the largest payer of healthcare services in the world. The healthcare system, the US not only acts as a payer, but sometimes a provider and regulator of healthcare. So if you think about it, we have CMS that acts in the role of a payer. We have providers such as the military hospitals and the VA, and then we also have the regulations, the regulators, the compliance arm of the US government. And this is overseen by the legislative, the executive, and the judicial branch. Some legislative initiatives go all the way back to 1935 with the Social Security Act. We also have the Hill-Burton Act of 1946, which basically freed up funding to build hospitals. With the Social Security Act Amendment of 1965 that created Medicare and Medicaid. With Public Law 92603, the Utilization Review Act, peer review improvement, tax equity and fiscal responsibility, and all these initiatives cast a shadow on healthcare. One of the big ones that you'll hear about in our profession of health information management is this one, the Health Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA, right? We also have similar acts, the Genetic Information Non-Discrimination Act, the GINA Act. We had the HITECH Act for Health Information Technology for Economic and Clinical Health Act under the Obama administration. We had the Affordable Health Care Act a year later in 2010. And then we had the Medicare Access and Chip Reauthorization Act, the MACRA of 2015. And then we had the 21st Century Cures Act of 2016. Healthcare in the United States is overseen by the Department of Health and Human Services. And the secretary, as we all know, is Robert F. Kennedy Jr. And the role of this position is to ensure that Health and Human Services provides essential human services. Under the department, the deputy secretary, we have the deputy secretary, chief of staff, and then we have the immediate office of the secretary, and then with the Office of Intergovernmental and External Affairs. Under Health and Human Services, we have all these offices here that you see on this page. Many of them you're probably familiar with. The Office of the Inspector General, for instance, which has a special relationship as they're the ones who oversee suspected violations of the False Claims Act. We also have the Office of Medicare Hearings and Appeals, and so on. We also have some operating divisions. The one you're probably the most familiar with are the two in the middle, the Centers for Medicare and Medicaid Services, normally known as CMS, and then we have the FDA, which is Food and Drug Administration. But in between, we have all these other agencies that are federal agencies. The CDC, which has been in the news a lot lately, which is actually named the Centers for Disease Control and Prevention. A lot of controversy about the current directions that the CDC is taking. Related to that, we also have the National Institutes of Health, Health Resources and Services, Indian Health Services, substance abuse, and many, many others. All of these fall under Health and Human Services. And again, here are some more. The government agencies, right? Another one that I have a special interest in, as one of my former bosses at Kaiser went to work for them, is PCORI, which is the Patient-Centered Outcomes Research Initiative. The first director was one of my directors at Kaiser, Dr. Joe Selby. And then finally, we have a lot of things going on with technology, particularly computer technology. We now have virtual health, we have telehealth, we have direct messaging. You get patient reminders on your phone. We have mobile health tools, e-scripts, mobile devices. And now, of course, we have AI, right? A lot of things about AI, we'll come back to that a little bit later in the course, but it's something that is doing a lot of things that we may or may not necessarily want to use it for. And the other thing to think about is, what type of AI are we doing? Are we comfortable with AI responding to our questions, right? About a medication refill, right? Would you be more comfortable if it just reminded you about an upcoming appointment that you have, right? Maybe you would, maybe you wouldn't, but in some way, shape, or form, it looks like AI is here to stay. Some things people are looking at for using it is improving outcomes, right? So you could theoretically put a bunch of signs and symptoms in and come up with a flow chart for patients and providers. You could use it for research to look at more efficient ways of lowering the cost for providing healthcare. Or you could look at it as a tool to benefit population health, right? Come up with things that help that improve the population health on an aggregate level. And then finally, we have auditing, right? So basically when we see auditing, we're talking about verification. So if somebody puts on an encounter form or a super bill that somebody has metastatic cancer, does the documentation support that they actually have it? Right. So auditing is basically some sort of verification. It's some sort of inspection, examination to make sure that what is actually being presented is actually true. And we have three different types. We have process, product, and system. So we've talked about all these things for a little bit. What exactly do they mean? And how does it affect our role in health information management? Well, the AHIMA definition of HIM is the practice of acquiring, analyzing, protecting digital and traditional medical information. And it combines business, science, and health IT. Here at Lane, you will graduate with a degree, an associate's degree, and be able to sit for the RHIT exam. There are four-year programs available, but for those, you would get a bachelor's degree and then sit for the RHIA. There are also master's degree options in HIM, health informatics, or even education. And that's all I have for you. We'll see you online. Bye now.